Ever get that feeling like something's stuck in your throat? No, not that leftover sandwich from yesterday. I'm talking about something stranger, something sneakier.
We're about to take a deep dive into the hidden world of tonsil stones, those little mysteries that can make you question your own breath.
What's fascinating about tonsil stones is that they're like these tiny little puzzles hiding in plain sight.
Most people have no idea what they are, even if they've encountered them.
Yeah, you're brushing your teeth and you catch a glimpse of this whitish yellow thing in the back of your throat. Almost looks like a popcorn kernel that got lost. So, are tonsil stones just food gone rogue?
Not exactly. Think of it this way. Your tonsils aren't smooth surfaces. They have these little nooks and crannies called crypts.
And sometimes, food particles, bacteria, all sorts of things can get lodged in there.
Over time, those particles can mineralize, almost like a pearl forming inside an oyster, except, well, in your tonsil.
So it's like a tiny, unwelcome pearl farm back there.
And our listeners send in a ton of questions about these things, like,
Oh.
first and foremost, is this normal?
Does everyone have tonsil crypts? And are we all just walking around with these ticking time bombs of tonsil stone potential?
Good news, not everyone gets tonsil stones.
While we all have these crypts, some people are just more prone to them.
Think of it like this. The deeper the crypts, the easier it is for things to get trapped.
So people with larger tonsils might be more susceptible, for example.
And frequent tonsillitis, which can cause inflammation and scarring, can actually make those crypts even more pronounced.
Okay, so that explains why some folks seem to be magnets for these things.
And speaking of magnets, our research mentioned some of these tonsil stones can get surprisingly large.
Like, not just a grain of rice, but bigger.
It's true. Most tonsil stones stay relatively small, but there have been cases where they've grown to the size of a grape, or even larger.
Imagine having something that big just hanging out in your throat.
Okay, I'm officially grossed out and suddenly feeling very grateful for my relatively small tonsil stone experiences.
But size aside, what's the big deal? Aside from giving unsuspecting dentists a bit of a fright, are tonsil stones something to actually worry about?
Well, you're right about the dentist part. Those checkups can get a little more interesting when you've got a tonsil stone surprise. But seriously, besides just looking kind of freaky, what's the actual impact of these things?
Let's just say tonsil stones don't exactly make you the life of the party because of the whole breath of a thousand forgotten lunches thing.
Precisely. That trapped debris can create a breeding ground for bacteria, and those bacteria release sulfur compounds. And those compounds, they're the culprits behind that telltale bad breath.
Okay, that makes a lot of sense. And our research mentioned some other not-so-pleasant side effects like a persistent tickle in your throat or even difficulty swallowing.
You're right, those sensations usually happen when the stones are larger and start to press against the surrounding tissues. Imagine having a tiny, crumbly pebble constantly rubbing against your throat. Not exactly comfortable.
Definitely not the kind of rock you want in your throat. And while we're on the topic of discomfort, our sources mention that in some cases, tonsil stones can actually lead to some pretty serious complications.
Yeah.
We're talking infections, abscesses, even tonsillitis, right?
It's important to remember that while tonsil stones themselves are usually harmless, they can sometimes be a sign of underlying issues or potentially lead to bigger problems. For example, if you're prone to tonsillitis, those inflamed tonsils with deeper crypts can become a haven for bacteria, and tonsil stones can make that situation even worse.
So it's like they're adding fuel to the fire.
Exactly. And in rare cases, a neglected tonsil stone can actually develop into an abscess, which is a painful collection of pus that requires immediate medical attention.
Okay, that definitely took a turn for the seek medical help side of things. So for those of us who might be dealing with the occasional tonsil stone guest appearance, what are our options? How do we evict these unwelcome tenants from our throats? So we've covered the what and the you of tonsil stones. Now for the part our listeners have been waiting for, the how do I get rid of these things? Because let's be real, nobody wants to be known for their tonsil stone collection.
Luckily, there are a few things you can try at home. Gentle gargling with salt water or diluted apple cider vinegar can help dislodge those stones and flush out the crypts.
Like a mini mouthwash spa treatment, but specifically targeted at those tonsil stone troublemakers.
Exactly.
And for a more direct approach.
A water flosser.
Oh yeah, those things. Do those actually work for tonsil stones?
Yeah, they can be surprisingly effective. The pulsating water stream can often blast those stones right out of their hiding spots.
Talk about satisfying. Though I do have a feeling it's one of those better over the sink kind of situations.
Definitely.
Our research did mention something about using sharp objects for this, though, and that's a big no-no, right?
Absolutely. Please do not try to dig out a tonsil stone with a toothpick or anything like that.
Yeah, that sounds like a recipe for disaster.
It is. Remember those crypts we talked about? They're delicate, and using sharp objects can injure them, leading to bleeding, infection, and a whole host of other problems.
Ouch. Okay, duly noted. Safety first, folks. So, no DIY surgery attempts, but let's say the at-home remedies aren't cutting it. What's the next step? Do I need to, schedule a tonsil stone extraction appointment?
For the occasional stubborn stone, your dentist can usually take care of it during a regular checkup. They have special tools to remove them safely and effectively.
So it's like a bonus cleaning service. But what about those cases where it's more than just a one-time thing? What if tonsil stones are like those house guests who never seem to leave?
If you're dealing with recurring tonsil stones, or if they're causing you persistent problems, it's worth talking to an ear, nose, and throat specialist, an ENT. They can assess your specific situation and determine if there's an underlying issue that needs to be addressed.
Okay, that makes sense. Sometimes you need to call in the specialist. But honestly, I'm more of a prevention is key kind of person. Any tips on how to keep these things from becoming regular visitors in my throat?
The good news is that good oral hygiene goes a long way in preventing tonsil stones. Brushing, flossing, and gargling after meals, those simple habits can make all the difference.
Music to my ears. So we're talking about things we should all be doing anyway.
Exactly. And of course, regular dental checkups are essential for maintaining good oral health overall, which can help prevent tonsil stones from becoming a recurring problem.
So there you have it. We've journeyed into the depth of tonsil stone mysteries, from what causes them to how to send them packing. And it turns out a little bit of knowledge and some good oral hygiene habits go a long way. But here's something to chew on. Our research mentioned tonsillectomy as a last resort for severe cases. It makes you wonder, in our quest to evict these tiny tenants, have we underestimated the role tonsils play in the grand scheme of our bodies? Food for thought as you embark on your next flossing adventure.